White House plans federal grants freeze as Trump agenda takes shape. A comprehensive analysis. The Trump administration's decision to implement a freeze on federal grants and loans has sent shockwaves across the nation, sparking widespread confusion, legal challenges, and concerns about the immediate and long-term impacts on state and local governments, nonprofits, and public programs. This move, which took effect at 5 p.m. Eastern Time on Tuesday, has left many organizations scrambling to determine how they will continue operations without access to critical federal funding. The freeze, outlined in a memo from the White House Office of Management and Budget, OMB, is intended to give the new administration time to review agency spending. However, its abrupt implementation has created chaos, particularly in states like Colorado, where federal dollars account for a significant portion of the budget. The immediate impact of the freeze on federal grants and loans has had an immediate and profound impact on a wide range of programs and services. Nonprofits, state agencies, and local governments rely heavily on federal funding to support essential services, from healthcare and education to infrastructure and public safety. Without access to these funds, many organizations are facing the prospect of shutting down programs, laying off staff, and reducing services to vulnerable populations. Sheridan, a representative from a nonprofit association, reported that several programs had already encountered issues accessing their grant funding through the Federal Payment Management Services system on Tuesday morning. These programs received error messages when attempting to log in, leading to concerns that the freeze had already taken effect ahead of the official deadline. For some organizations, the inability to access funds means they may not be able to pay their staff, forcing them to consider whether they can continue operating. Some programs that I just spoke with are having the discussions and trying to figure out, are they going to be able to open their programs tomorrow or not? Sheridan said. If these programs are forced to close, the ripple effects could be significant, affecting not only the individuals who rely on these services, but also the broader community. For example, parents who depend on childcare programs may be unable to work if those programs shut down, creating a cascading impact on local economies. Legal challenges and state responses. The Trump administration's decision to halt federal grants and loans has not gone unchallenged. Several nonprofits have filed lawsuits against the administration, seeking a temporary restraining order to prevent the freeze from taking effect. These organizations argue that the freeze violates federal law and could cause irreparable harm to the millions of Americans who depend on federally funded programs. In addition to legal challenges, Democratic attorneys general from several states, including New York, California, Illinois, New Jersey, Rhode Island, and Massachusetts, have announced plans to sue the Trump administration to stop the freeze. These states are moving to keep federal funds flowing to state governments and cities, arguing that the freeze would disrupt critical services and create unnecessary hardship for their residents. The legal battles highlight the high stakes involved in the administration's decision. Federal grants and loans are a lifeline for many states and localities, providing funding for everything from healthcare and education to transportation and public safety. The freeze threatens to undermine these essential services, creating uncertainty and instability at a time when many communities are still recovering from the economic impacts of the COVID-19 pandemic. The impact on Colorado. A case study. Colorado provides a stark example of the potential consequences of the federal grants freeze. Federal dollars account for approximately 30% of the state's $40 billion annual budget, making the state particularly vulnerable to disruptions in federal funding. The freeze has thrown Colorado's budget into chaos, with state officials scrambling to determine which programs and services will be affected. Senator Jeff Bridges, D. Greenwood Village, the chair of the Legislative Joint Budget Committee, expressed concern about the impact on Colorado residents. "It doesn't look great for the people of Colorado," he said. The state relies on federal funding for a wide range of programs, including healthcare, education, and infrastructure. The freeze could jeopardize funding for critical services, such as rural hospitals, programs for homeless veterans, and Head Start programs that serve nearly 9,000 children in the state. U.S. Senator John Hickenlooper, Colorado's former Democratic governor, echoed these concerns in a statement, warning that the freeze could halt funding for police departments, rural hospitals, and programs for homeless veterans. He also highlighted the potential impact on Head Start programs, which provide early childhood education and support to low-income families. Nearly 9,000 kids in Colorado Head Start programs may be locked out, Hickenlooper said. The freeze has also created uncertainty for state budget writers, who are midway through crafting the next spending plan for the 2025-26 fiscal year. State Representative Emily Sirota, D. Denver, a state budget writer, described the situation as an "oh my god" moment, with officials trying to figure out the implications of the freeze. "I think we're all trying to figure out what it means," Sirota said. The broader implications of the freeze, the federal grants freeze, has far-reaching implications that extend beyond individual states like Colorado. The federal government was projected to contribute $13.4 billion to state-level programs in the coming fiscal year, with the bulk of that funding, 74%, earmarked for healthcare and related safety net programs. The freeze threatens to disrupt these programs, potentially leaving millions of Americans without access to essential services. In addition to healthcare, the freeze could impact a wide range of other programs, including education, transportation, and public safety. For example, the Regional Transportation District in Denver received $150 million from the Federal Transit Administration to help complete the East Colfax Rapid Transit Line. The freeze could delay or derail this critical infrastructure project, creating ripple effects throughout the region. The freeze also raises concerns about the Trump administration's broader agenda and its approach to federal spending. While the administration has framed the freeze as a temporary measure to review agency spending, critics worry that it could be a precursor to deeper cuts in federal funding. State budget writers in Colorado and elsewhere are wary of what's to come from Washington, particularly in light of the administration's past proposals to slash funding for social programs and other domestic priorities. "There are any number of things that can be done that could dramatically change our budget and our ability to serve Coloradans in the way we do," Sirota said. The uncertainty created by the freeze makes it difficult for states and localities to plan for the future, creating additional challenges for already strained budgets. The human cost of the freeze: while the freeze has significant financial and logistical implications, its human cost cannot be overlooked. The programs and services affected by the freeze serve some of the most vulnerable populations in the country, including low-income families, seniors, and individuals with disabilities. For these individuals, the freeze could mean the loss of access to critical services, such as Meals on Wheels, which provides meals to homebound seniors, and Head Start, which offers early childhood education and support to low-income families. The potential impact on these programs has sparked outrage among advocates and policymakers, who argue that the freeze prioritizes political goals over the needs of the American people. "This is not just about numbers on a spreadsheet," said one advocate. "This is about real people who depend on these programs to survive." The freeze also highlights the broader challenges facing the country as it seeks to recover from the economic impacts of the COVID-19 pandemic. Many of the programs affected by the freeze were already struggling to meet increased demand due to the pandemic, and the loss of federal funding could exacerbate these challenges. For example, food banks and other nonprofit organizations have reported a surge in demand for their services during the pandemic, and the freeze could make it even more difficult for them to meet that demand. Looking ahead, what's next for federal funding? As the legal and political battles over the federal grants freeze continue, the question of what comes next looms large. The Trump administration has given agencies until February 10 to submit detailed information on any programs, projects, or activities subject to the pause. This information will be used to determine which programs will be affected by the freeze and for how long. In the meantime, states, localities, and nonprofits are left in a state of uncertainty, unsure of how they will continue to fund essential services. The freeze has created a sense of urgency among policymakers and advocates, who are working to mitigate its impact and ensure that critical programs continue to receive funding. The freeze also raises broader questions about the role of the federal government in supporting state and local programs. Federal grants and loans have long been a key source of funding for these programs, and the freeze highlights the extent to which states and localities rely on federal dollars. As the debate over federal spending continues, these questions are likely to remain at the forefront of the national conversation. Conclusion: the Trump administration's decision to implement a freeze on federal grants and loans has created widespread confusion and uncertainty, with potentially far-reaching consequences for states, localities, and nonprofits. The freeze threatens to disrupt critical programs and services, leaving millions of Americans without access to essential support. As legal challenges mount and states scramble to assess the impact, the human cost of the freeze is becoming increasingly clear. While the administration has framed the freeze as a temporary measure to review agency spending, its abrupt implementation and potential long-term implications have sparked outrage and concern. As the nation grapples with the ongoing impacts of the COVID-19 pandemic, the freeze adds another layer of complexity to an already challenging situation. The coming weeks and months will be critical in determining how the freeze is implemented and what it means for the future of federal funding. In the meantime, states, localities, and nonprofits must navigate this uncertain landscape, working to ensure that essential services continue to reach those who need them most.